The mental health burden in Kenya is becoming a major concern. A country with a population of over 45 million people coming head-on with the effects of the COVID-19 pandemic. Statistics of mental illness indicate that the numbers are soaring, raising a red flag. Research indicates that 1 out of 4 Kenyans have a mental illness.
I've noted with extreme sadness and profound concern the recent rise in reported cases of suicides and homicides in the country, particularly femicides.
In 2019, President Uhuru Kenyatta set up a task force to look into the state of mental health in Kenya. The task force, led by renowned psychiatrist Dr. Frank Njenga, in its findings handed over to Health Cabinet Secretary Mutahi Kagwe, revealed a country in desperate need of help. According to research and what the task force was told by Kenyans, mental and neurological disorders are common and widespread. It was clear that at least 25% of outpatients and 40% of inpatients in different health facilities in the country had a mental illness, and an estimated prevalence of psychosis stated as 1% of the general population. The common mental illnesses in Kenya are depression and suicide, substance use disorder, bipolar disorder, schizophrenia, and among other psychoses.
We established, number one, that there is a very, very high burden of mental disorders in our country. Secondly, we established that this burden is not matched by the resources allocated for this very big problem. And thirdly, we established that partly because of ignorance and partly because of fear, there is a great deal of stigma surrounding the whole field of mental ill health.
The crisis called for a deliberate attention with a focus on modern mental health treatment, and it is on this backdrop that 3 lead psychiatrists, members of the Royal College of Psychiatry, paused to draw a new roadmap to address the problem that was unknown to many 25 years ago. They saw the need of a specialized hospital focusing on mental health to provide promotive and preventive mental health care service.
We decided that we shall start something that would supplement or complement what the government was offering. And that is where we came up that we shall start something for mental health services in this country in the private sector. It was a long journey.
To do that, we had the perfect location. And before we did it, we benchmarked, we traveled, we went to Pretoria, went to Durban, went to Johannesburg to see how hospitals for mental health are built, especially a high-rise, to make sure that the safety measures are in place. And yes, we were able to have a very good team, the whole team, the architects, the contractor, and the subcontractors. Everybody was excellent, and we did it in super time.
If that did not happen and we continued to really give lip service, as it were, to mental health issues, a lot of the social issues that we are facing, you hear of suicides, you hear of, family members killing each other, you hear of especially those sort of high-stress professions.
Welcome to Chiromo Hospital Group. My name is Eva Swani. I work at the admin department.
And Chiromo Hospital Group is the fulfillment of that vision.
The type of service that is being offered here, we want it to be offered to every Kenyan. Yeah, that will make me happy.
When you hear about mental health and you see the places that people are treated, some may never even get well. because they are put away, they are locked up.
By embedding the principle that the patient comes first and is at the center of everything that we do, we are at the front line.
As at the 25th year, we have well over 210 staff members working to provide dignified, quality mental health care.
Specifically to undo that side of stigma by creating an environment of care that didn't require people to be tied up, didn't require people to be in dark places without air or light. So everything we have done in the 25 years of our existence has been around trying to create dignified care for people with mental illnesses.
This just shows that we have begun the journey of transformation of treatment of mental health away from what we have all known. This also addresses the issues of stigma. And so today we are very happy to be here to see the leaps that we are making as a nation in bringing dignity to the treatment of people suffering with mental health.
As the Ministry of Health, and indeed as Kenyans, we are extremely proud of what you have done here, of the way you have taken us to the next level as far as those who have got mental illnesses are concerned.
Celebrating 25 years of successful existence. Firmly anchored on the pillar of preventing mental illnesses and promotion of mental wellness.
Your temperature is okay, in the normal range, that's 6.9.
Chiromo Hospital Group offers a dignified quality mental health care service in Africa and beyond by adhering to evidence-based medicine. It is an ultra-modern specialized level 5 hospital with advanced technology. The hospital is standing in the gap as the leading mental health care hospital in the region to reduce the mental health burden. The state-of-the-art facility also serves the entire African continent in Nairobi with regular referrals in and out of Kenya. Chiromo Hospital Group strives to offer a dignified recovery through integrated programs targeted at getting the desired results.
The team is solid on preventive mental health care and promotive mental health care. The psychiatrists, the psychologists, and the psychiatric nurses, working together with well over 70 corporates, an increasing number of corporates out there, work to normalize the conversation on matters mental health. The stigma, the discrimination that has been so entrenched in mental health care can only be reversed when collaboratively we push this conversation in the normal social spaces.
The impressive work that is going on here amongst the many psychiatrists and other professionals who are working here, to really congratulate even you, doctors, and to ask you to please continue raising the flag for our country in that very unique and special manner.
We should not look at mental health as something that you look down upon or say this wrong thing and so forth. It is just like any other illness. And we should change our attitude towards that.
Apart from dealing with stigma, which is a big, big issue, I think we need to learn to deal with that much, much better. And to treat anybody who has any mental health challenge, sensitively and how they need to be treated.
Dignified quality mental health care services are available for you. The government cares about our welfare in the service, and that is why we have the insurance cover. And let us not suffer in silence. Allow the officers to open up and discuss mental health matters devoid of stigma and discrimination.
Personally, for the last 3 months, I've brought 7 officers, and apart from one who was referred back because of some disciplinary cases, all the others are back. And Apart from us as the police service appreciating, their families have really appreciated.
The inpatient and outpatient mental health care programs are fully integrated with a multidisciplinary team of well-trained and qualified psychiatrists, psychologists, psychiatric nurses, counselors, spiritual leaders, pharmacists, and laboratory technicians, all under one roof, working to deliver quality outcome through face-to-face and telepsychiatry platforms.
We are focusing on promotive and preventive services as opposed to curative, which we do also provide here at the Chiromo Hospital Group. But our focus is shifting more towards what we call community psychiatry. And therefore that we have to be able to develop the acumen and the ability to diagnose mental health issues before they actually become illnesses.
All what we've done is unveil it and say, this is what has been hiding, this is the elephant in the room. Like, we're fighting communicable diseases, but hand in hand, mental health is equally affecting us in the same magnitude.
As we provide psychiatric and psychological services, we want our clients to also have that benefit of nature. Even as we do the psychological intervention from outside, we want our clients to feel like they're just having a conversation, but at the same time, they are getting a treatment. And also just to enhance that feeling of in a relaxed setting. Some would say they feel like they're in a hotel. So it takes away actually that feeling of I'm in a hospital.
It's quite a vast discipline in nursing that requires a lot of emotional intelligence.
With the support of the management, they have really supported us, especially the lab. We are provided with state-of-the-art equipment. Timely results have also aided in the management of the patients. So far, we have been able to run tests that have aided in the diagnosis of our patients.
One of the things that has given me, I can say, satisfaction is seeing patients coming in. You watch the status they come in. Some of them are very, in terms of their mental status, they're not very well. But when they're leaving hospital, you feel that satisfaction that you've really helped that patient because you can clearly see the change.
We take pride in keeping the rooms clean and also issuing clean bedding to the patients, because once a patient enters a room and it's well arranged, it's neatly arranged, it helps them in their recovery.
We get a dietary meal from the doctors and we follow strictly that dietary meal so that we don't go out according to the treatment.
We have served dignitaries, some international, others from the country, and they have complimented our service.
I assure you that the security here is very paramount. Anybody who attends this facility, we do handle each and everybody carefree and with a lot of customer care, courteousness, and professionalism.
From the work that we have done, we've been also able to publish a case study on the use of social media to harness the mental health care gap in Kenya, and this paper was published in the Pan-African Medical Journal.
The silver lining, just like any other non-communicable diseases, is mental well-being can be promoted and mental illnesses are preventable.
Once in a while, we have one or two cases where they are not able to pay, and sometimes we consider it as a social corporate responsibility.
Our 25-year legacy is based on the people. We've had staff who've been here since the inception of this great brand, the Chiromo Hospital Group. Over these years, they've worked tirelessly onboarding other team members.
Every unit at the facility works towards the recovery of our patients. With a consolidated 180-bed capacity, the hospital is driven by a core team of 38 psychiatrists, 54 psychologists, and a team of 171 multidisciplinary team members to deliver the following curative and mental wellness program. The treatment methods at the facility include outpatient services, detoxification, psychotherapy, addiction treatment, mental health program, art therapy, group therapy, family therapy, occupational therapy, and nursing care. We give our patients first-class treatment as we walk with them on the recovery journey. The hospital has 3 branches in Nairobi, 2 located along Muthangari Road, Lavington, and 1 in Westlands, with 201 strong core team members working around the clock serving the mental health care space with utmost respect, honesty, and reliability. Chiromo Hospital Group is dedicated to make mental health care fashionable. The partners are proud to be associated with Chiromo Hospital Group, a leader in mental health.
Quality, affordable, and investments on the right place.
Chiromo Hospital Group serves Kenyan and international clients at individual and institutional levels, and many who had lost hope have a story to tell after their contact with Chiromo Hospital Group.
The environment in which psychiatric care is provided must be tailored to meet the needs of different clients. Occasionally we admit clients who have suicidal tendencies, clients who have self-harm behaviors, clients who in any other day would not want to be in a contained environment. Chiromo Hospital Group built an environment in which the safety of our clients comes first. With their special needs in psychiatric care is factored in, and we ascertain that their ultimate safety, security, the safe space in which they heal with dignity is provided in Chiromo Hospital Group.
One of the things that Chiromo did is it provided a safe space. The tagline is recovery with dignity, and it's easy to kind of overlook that, but for the time that I was here and even the time when I left, I knew that there was a space where I could just be me.
The second thing that the Chiromo Hospital Group is already doing is to be at the center of training and ensuring excellence in evidence-based healthcare. We as a group are committed to ensuring that only qualified individuals provide care to our patients. For that reason, we have recently linked up with AMREF International University, for example. We have an advanced diploma program going on right now as we speak to ensure that all our counselors have the requisite clinical skills to give recovery in dignity. As we go ahead, all our nurses will undergo similar programs. Doctors will undergo similar programs to ensure that they only provide evidence-based. And by the end of this next period of 25 years, this group will be, if God wills, a center of science and research in mental disorders of repute in the entire continent of Africa. That I promise you.
From the trainings in medical schools, nursing schools, psychology training schools, they are so solid on the theoretical aspect. And as it has been, there's been not many opportunities for people to receive a highly practical, engaging approach to mental health care practice. This environment at Chiromo Hospital Group is also built to provide solid training on mental health. So the first program that we have rolled out is the Advanced Diploma in Applied Mental Health Practice in partnership with AMREF International University. The second program that is in the pipeline is now the Specialized Psychiatric Nursing. We understand and appreciate the role that the Kenya Medical Training College has played in training many cadres, not only nursing, clinical officers, and other medical cadres. The specialized psychiatric nursing, again, is an important course that is provided by KMTC. We are looking forward to a greater partnership with KMTC to provide psychiatric nursing that will be able to meet the increasing demand for people in the private sector.
Chiromo Hospital Group is running a campaign dubbed Tufunguke, Swahili for Let's Open Up, aimed at ending any form of stigma associated with mental illness and encouraging the population to speak up as opposed to suffering in silence. Chiromo Hospital Group is rewriting the mental health care story in Kenya. At Chiromo Hospital Group, we say recover in dignity. Chiromo Hospital Group.
Tufunguke. Tufunguke tuongee.
Tufunguke kumaanisha tujizungumze na tujitambue na tuseme kwamba sisi ni binadamu kama wengine wote, na hii hali ya magonjwa ya kiakili ni jambo la kawaida ambalo kwa kweli ni sharti tulizungumze.
Chiromo Hospital Group. Tufunguke.